Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
So what is Mpox? According to the World Health Organization, Mpox is caused by the monkeypox virus, related to smallpox, which was eradicated in 1980. Mpox has two clades. Clade 1, which is more severe with a 10% fatality rate, and Clade 2, which is milder and endemic to West Africa.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying.
As of today, this new strain of Mpox has been detected beyond Africa, including Sweden of Europe, as well as the Philippines and Thailand as the first countries in Southeast Asia to report it. Malaysia recently confirmed its first case of the milder Clade 2 Mpox. Mpox was first identified in Denmark in 1958 when monkeys used for research showed signs of illness. The exact source of the virus remains unknown. The first human case was recorded in the Democratic Republic of the Congo in 1970. The CDC indicates that Mpox cases outside endemic regions are rare and usually linked to travel or imported animals. Mpox spreads through close contact, such as skin-to-skin interactions or talking, which releases respiratory particles. Infected animals can also transmit the virus through scratching, biting, or other close interactions. Mpox can also spread via contaminated objects like clothing or through needle injuries in healthcare and tattoo parlors. Contracting Mpox during pregnancy can be dangerous as the virus can be passed to the fetus, leading to complications or miscarriage. According to WHO, symptoms of Mpox usually appear within a week after exposure, though they can take up to 3 weeks. Key symptoms to watch for include rash, fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes. The rash often starts on the face and spreads across the body, including the palms and soles. These symptoms typically last between 2 and 4 weeks, but recovery may take longer for individuals with weaker immune systems. Are there vaccines available for Mpox? Yes, there are, and it is recommended to get vaccinated within 3 days of exposure to prevent infection. The World Health Organization recommends prioritizing high-risk groups, including healthcare workers, children, pregnant women, and those with weakened immune systems. If you're infected, the World Health Organization recommends isolating in a well-ventilated area, wash your hands often, disinfect shared spaces, wear a mask, and cover any lesions when around others. When should you start quarantining? Begin during the infectious phase, from the onset of symptoms until lesions heal and scabs fall off. How is Mpox being managed? The World Health Organization emphasizes that Mpox is a familiar disease and current control measures are in place. Unlike COVID-19, large-scale lockdowns or travel restrictions are not expected, but health monitoring is active at international entry points. Health Minister Zulkifli Ahmad stated that measures are in place at all international entry points to reduce Mpox transmission risk. Passengers are screened with thermal scanners and 30 Health Ministry officers are stationed at KLIA Terminal 1. With the public facing another health emergency, the World Health Organization calls for enhanced surveillance and contact tracing, along with equitable access to treatments to curb the spread of Mpox. Stay tuned to KiniTV for more in-depth coverage and the latest updates on this evolving story. This is John Ng reporting for KiniTV.